Welcome to the People's View. I'm your host, Carl Seidel. The People's View is sponsored by the Nashua Republican City Committee, and you can find out more about the activities of the committee by going to its website, nashuagop.org. We meet on the second Thursday of the month at the Crown Plaza Hotel Auditorium, and we'd like to see you there.
Welcome to The People's View, a program dedicated to discussing local, state, and national issues and their effect on the American people. The People's View provides a platform for state representatives and national figures to present their viewpoint. Whether it's social, economic, or financial topics, you'll hear it on The People's View.
Today we have Representative Lynne Ober. Lynne, you're on the Finance Committee, the minority leader on the Division 1. Can you tell us a little bit about yourself and how long you've been up there in the legislature?
Thank you, Carl. It's nice to be here with you. This is my 10th year in the legislature. I've spent 8 years on the Finance Committee. My first 2 years I was on Science, Technology, and Energy. And I've done a lot of things. I chaired the Municipal and County Committee. I've been vice chairman when the Republicans have been in charge of the Finance Committee. I've worked on education funding. I've just had a really nice time. It's a way to give back to the state.
And so you had a lot of things on your plate this session. Tell us what's happened. I mean, the big thing that I guess you people started with was the Medicaid expansion.
Well, we started with the budget.
Oh.
Every odd year, which is the first year of the biennium, we budget in New Hampshire, and we budget for 2 years. So we started with the budget. We sent a budget to the Senate that wasn't quite balanced. And what happened was the governor decided to spend the $80 million of casino licensing revenue in her budget in February. But that bill didn't pass in spring. So the budget wasn't quite balanced. Senate made some changes. We got together in a committee conference and we passed a balanced budget. New Hampshire is a balanced budget state, so we cannot borrow money to balance the budget. We have to live within our means, which I think is good because every New Hampshire family has to live within its means.
Right.
You know, you get your income, you pay your bills, you don't have somebody giving you extra money to spend. Then we did work on expanded Medicaid, which did not pass. And I'm not sure if it will pass. It's very complicated. It has potential of helping some people, but not as many people as we've heard about. It has a potential of offering better medical service than people in my district are getting under Obamacare. And I don't know if you know what happened in New Hampshire, but Obamacare is in effective January 1st, and you have to have a provider. The state does. That provider only works with half of the hospitals. So my constituents live in Hudson and Pelham. Our closest hospital for those of us who live in Hudson is Southern New Hampshire Medical Center. That is not an Obamacare authorized hospital. If your primary care physician had credentials at Southern New Hampshire, he or she probably didn't have credentials at St. Joseph's, which is an Obamacare hospital. And so you had to change your doctor, you had to change your insurance, you have to now drive farther to get to St. Joseph's. The people in Concord have it even worse. There's one hospital in Concord. It is not authorized under Obamacare, so everybody who had a primary care physician in Concord had to switch to a primary care physician in another town. Most of them went to Manchester, which is south, and also changed the hospital. So we've had some issues, and we've been trying to work those out. We haven't come to a reasonable compromise yet. We haven't been able to work with the federal government to try to make it more equitable for everybody.
It's a very complex situation, and you hear lots of different facts, and you have to wonder, well, how much is that true? For example, you were talking about how many are going to be covered by Medicaid in the states that have decided to expand Medicaid. And some of the numbers that are recorded in the media anyway, that more people are switching from private insurance to Medicaid than the ones that they were trying to get that didn't have any insurance at all.
Well, that's happened, Carl, but the other thing is, if you're between the ages of 55 and 65, and you are not eligible for Obamacare. So, number one, Obamacare does not provide insurance for everybody.
Right.
They said they did, but that's not the case. What they did was they made a bottom line income level. If you don't make X amount of dollars or more, you're not eligible for Obamacare. So it's not insurance for everybody. If you're between 55 and 65, the states that have gone to expanded Medicaid also have the right under this program of actually writing rules to loan you the money. So you don't have insurance. Are they covering your doctor's visits? Yes. Are they covering your prescriptions? Yes. When you die, they are going to recover all those assets from your estate. So if you thought you were willing your house to your kids when you died, no, the government has the first lien on the house equivalent to 100% of everything they paid for under expanded Medicaid. That somehow doesn't seem right to me.
And it doesn't seem like it's in the media either. Nobody reports it.
No, nobody reports it in the media. Expanded Medicaid for a long time has been a program where you had to have a certain income level and another qualifying event. You were disabled, you were blind, you met one of these other qualifying events. So you had 2 events to get on Medicaid. And then for long-term care, say you went to a nursing home, you were loaned the money under Medicaid, and they went after your estate when you died. So again, if you had a house and you went to a nursing home, they recovered 100% of the cost in the nursing home if there was enough money in the value of your house to pay for it. So that's been around for a long time. With expanded Medicaid, it's only an income level. If you're below a certain level of income, you don't qualify for Obamacare, you now qualify for expanded Medicaid. But if you're between 55 and 65, or if you, after 65, go into long-term care, they're going to take that money out of your estate. Now, obviously, if you and your wife are on expanded Medicaid, you die and she's alive, they don't go after the money until she dies. So she
gets her,
retains the house, retains the right to have additional expanded Medicaid coverage. But when she dies, if you've got kids you were going to leave it to, now the government has the first lien on your house.
And what I heard too is that the Medicaid, it really doesn't help. I mean, it doesn't reimburse the doctors as much as the regular Medicare would.
No, Medicaid reimburses the doctor something like 32 cents on a dollar. So for every dollar they spend, they get 32 cents back. And there are a lot of doctors that don't take Medicaid patients. For example, Southern New Hampshire Health Systems, which has the hospital, Southern New Hampshire Medical Center, also has the Foundation Medical Partners. And their primary care physicians do not accept any Medicaid patients. Their specialists, if you get referred from a low-income clinic, such as Lamprey Healthcare, which is here in Nashua, their specialist will take Medicare patients, but Medicaid patients, but the waiting list is long. Takes a long time to get in. So it's not
So people, you're not going to help out as many people as it was sold as being a big help to all these people that didn't have insurance, couldn't get insurance or whatever.
No, you're
I
not.
mean, the current situation without expanded Medicaid here in New Hampshire would actually see the people get service if they needed it.
Yes, the bill that didn't pass, that we worked on in the fall, said that if you had health insurance with an employer and you were income eligible for expanded Medicaid, you would stay with your employer's health insurance and you would get a subsidy to help pay the piece that you're paying with your employer. But you would not be able just to move to expanded Medicaid. But in New Hampshire, we have coverage for women with breast cancer and cervical cancer above and beyond, and they were going to drop that program and put those people on the expanded Medicaid program. So there would be some people who have insurance now who would lose that, who would have to go to something else.
Well, that sounds much more reasonable. What was the argument used to defeat the bill?
There were a couple of things that they just couldn't work out. Number one, the Senate version, because of course you were in the legislature. There's a House version, there's a Senate version. The Senate version would, after a year, transition everybody onto the Obamacare with a subsidy from the state, so that we would be using Obamacare and the healthcare system would be equitable for everybody in the state. The House version didn't want to do that for 3 years, and that the Democrats in the House just refused to converse with the Republicans in the Senate, and they were entrenched, and so neither version passed. No compromise was worked out. However, that gave him a little time to look at some other issues, and there were a number of issues. And this morning in the Boston Globe, which I read, there's a long article about people in Boston who used to have health insurance because of Obamacare, had to go through the same switching as we've had people in my district go through. And there's something wrong with the Massachusetts state exchange. Payments aren't being credited, so people are losing, their health insurance has been denied, they have no coverage. With the expanded Medicaid, the state would have to have its own marketplace like Massachusetts does. Well, let's face it, the Obamacare rollout with the computer system to enroll was a bloody disaster. Now Massachusetts state is having a disaster. We don't have that software in-house, would have to be developed for us, and to try to do it and roll it out early in 2014 was not realistic. So that was a big gating factor.
And that was the reason that the House used the 3-year waiting period, wasn't it?
No, because they needed to have that in order to start registering people in January.
No, but I meant that you wanted to wait to 3 years.
Well, the Senate wanted to wait 1 year and go straight onto the Obamacare marketplace, so that the state wouldn't have to develop that.
Right.
Then there's this $7.5 million gaping hole.
Right.
When we passed the budget in 2013, we have a $10 billion budget. We spent all the expected revenue in the state for 2 years except $44,000. To start expanded Medicaid, they needed $7.5 million in order to enroll people. Obamacare and the expanded Medicare program reimburses zero of that $7.5 million. So the question was, where are we going to get $7.5 million? And we were now in November. And how are we going to train the people that need to be trained to enroll people in this program by January 1st when it's November? And there were just a lot of moving pieces that even the agency, this is Health and Human Services, just said, well, we need to hire this many people. Well, can you reasonably do that if we pass this bill on Thanksgiving
I have to get
by
it
the
done.
1st of January and have your people trained? Well, no.
So that's that. Well, I'm sure there's a few other things that are on your plate. What do you think is next, the next big bill? I mean, there's a couple of different things going on.
Oh, there are a couple of things going on. Legalizing marijuana passed the House.
Uh-huh.
It's gone to Ways and Means. I don't sit on Ways and Means, but Ways and Means had a lengthy public hearing yesterday. And Department of Revenue Administration, who would be responsible for figuring out how to tax it, how to administer it, how to take care of all those pieces, came in with an absolutely excellent presentation on what they could do and how they would do it. They've thoroughly studied what's going on in Colorado, and they were just very prepared. I was extremely impressed with them. John Beardsmore is the new commissioner of DRA. He's done a wonderful job with that agency, and they were just very well prepared. Where is that going to go? I don't know. I mean, they just had their public hearing, and Ways and Means has to really work on that. The Democrats in finance want to reopen the budget and spend another $7 million. Now, we need $7.5 million to administer expanded Medicaid. The AG settled the mental health lawsuit, so we need $8 million this year for that, $7 million next year. And now the House Democrats want to spend yet another $7 million. Where this money is going to come from, I don't know, because while revenues are up, they're not up that much. So I think we have to be careful with overspending.
Definitely, definitely. I mean, that's one of the things that's changed since 2010 is we're spending what we take in rather
Yes,
than
in
spending more.
2010 we had almost $55 million in red ink when the year ended. So when we started doing the budget in 2011, we had to make $55 million worth of cuts just to cover the budget. Because again, we are a balanced budget state, so you couldn't borrow $55 million. So they basically spent against the 2011 revenues. It was a nightmare scenario.
I can imagine. And too bad we can't get the federal government to do a balanced budget.
Yeah. Kelly Ayotte talks about that and wants a balanced budget amendment. And I think that would be a great idea.
Well, it'd be a very great idea. I don't know, the transition might be the most horrible thing we
Oh,
ever
it would
saw.
be horrible. Yeah, the transition would be horrible. I mean, if you look at, what was it, the fiscal cliff?
Yeah.
They had to cut 0.1% over 10 years,
that.
and you would have thought that the world was going to stop.
that's
No
right.
airplanes would fly. Everything was coming to a screeching halt. 0.1% spread over 10 years, and yeah.
Well, all these things that they're saying they're going to do over the next 10 years, they probably won't do anyway. You know, I mean,
It's
they
hard to
changed
tell.
that, yeah. But anyway, well, what we do need, you talking about needs for money, one of the other big things that's crying out is the infrastructure in the state. They need some more money. What are we going to do with that?
Oh my God.
I
Don't
mean,
get me started on this. This is one of my hot buttons. And in the first place, if we collected the highway fund money and we spent it on the bridges and the roads, we would need no additional money. However, the Department of Safety sucks off 37% of the highway fund.
It's 37% now?
37%.
I thought
The
it was
governor gave them another 11% in her budget. 11% of a million upon million dollar fund to hire 10 state troopers. And I was wondering to myself, what are we paying state troopers?
Yeah.
$500,000 a year? Because to take 11% was unbelievable. The highway fund money needs to go to the highway fund. And it's not. The judicial system gets a percentage. Safety, I just said what they get. And both safety and the judicial system use this as justification. I love this. There's no public transportation to speak of in New Hampshire. Therefore, every crime committed is committed by somebody driving a car. Therefore, judicial and safety should get the highway fund money to run their agencies.
Oh, boy.
Now, Dave Campbell tried to, in fact, pass a House gas tax
Right.
increase, but it was 12 cents a gallon. I think that was just too much, too fast. 12 cents a gallon when people in this area are still struggling. A lot of people took pay cuts, lost their jobs, didn't have a job that was going to pay them what they used to make. There is a bill in the Senate to raise the gas tax, and I spent all my time not all my time, but I spent a lot of time sending Department of Transportation Commissioner Christopher Clement information about electric and hybrid cars. Because I would like an electric car. And I sit on a board, and one of my fellow board members bought a Ford C-Max, which is electric. He last bought gas in April. The idea behind the gas tax, you're driving on the roads, you're driving on the bridges, you're buying a gallon of gas, you're paying the gas tax, it's a road toll. The more you drive, the more gas you buy. The more you drive, the more road toll you buy. The more you drive, the more you wear down the roads and the bridges, so you're paying your fair share of keeping those up. We all want cars that get better gas mileage now with the cost of gas. And we're looking at hybrid cars. I mean, the Prius has been out forever, but the Chevy Volt, I tried to drive a Chevy Volt last year 2 or 3 times, McMulkin Chevy here in Nashua. Couldn't keep them on the lot. They just had a waiting list for people who wanted them. BMW's coming out with 3 electric cars this year. 2 of them will have auxiliary gas engines. So we have to find a way for everybody to pay their fair share for the road upkeep. The state of Oregon is going to put a chip in a car that tracks the miles you drive. Not where you go, the miles you drive. And then you will be assessed your gas tax or your road toll based on the miles you drive. So you'll pay your fair share. We're going to have to do that, or the federal government is going to have to find some way of doing that, because they also get gas tax. That's how we have the interstate, and then disseminate that money back to the states. I don't know where it will go, Carl, but it's not enough to just raise the gas tax.
No, it isn't. Is there any hope of changing that percentage that goes elsewhere? Or, well, one of the other things they did was to have a registration tax.
We, House Finance saw a bill 3 years ago that would have gone into effect July of this year that said the maximum that safety could get out of the highway fund is 26%. And the governor wrote into her budget an override for that, so that law didn't have to be obeyed.
So now you can't write a law that says that it
Well,
has to be
even if you
obeyed?
write a law now, you couldn't take the budget away from them in this year or next year. We passed a 2-year budget, and you'd have to make it effective July 1st, a couple of years out, which is how we passed that
certainly
bill a
didn't
couple
make
years
the
ago.
media either, that
No,
little
that didn't
increase.
make the media at all.
Nobody saw that at all.
There's a lot in the budget. You have to read the budget very carefully. And let's face it, the media is more interested in the fast soundbite. I mean, when the Senate came out with their budget, the governor was all over the press with how horrible that budget was, how horrible the Senate Republican budget was. It was going to kill all the people. We got to a committee of conference, and the committee of conference is always chaired by the House Finance Committee. So Mary Jane Wallner chaired that. And one afternoon at 4:30, she said, well, we are not going to come to agreement on the budget, so we're going to take a dinner break. We're going to come back just to hear Senator Bragdon's proposal for expanded Medicaid, and then we're done. It took the governor not a minute to get from her office across the street to Mary Jane's office and that was rescinded. And then when the budget was passed, it was 100% what the Senate Republicans had come out with. And suddenly the governor thinks it's the best budget since sliced bread, and she's taking credit for it. But 2 weeks before, she'd been out saying, oh, that's the worst thing ever. It's horrible for the state. We're going to have people die, da, 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 da. It's the soundbite.
Well, was that? I was always wondering whether if they couldn't agree, it's a default budget. Was that
We
your-
don't make a default budget. You're thinking like towns. I mean,
Yeah.
I live in Hudson, Senate Bill 2 town. You vote on the warrant. Here's the proposed operating budget, and then the default budget is this. They don't do that. What they do is prepare a continuing resolution that allocates so much money for essential state functions to keep the state going, and then they have to come back together as a committee of conference, and they have to hammer out a budget.
Okay, but if they don't hammer out a budget, what happens?
The continuing resolution, or they
Just
close
continues.
the,
Which is
they
really,
close
but
state government.
it's based on the budget at the time that continuing resolution is
Yeah.
made. So that would have been a worse thing in their scenario.
As far
than-
as the Democrats were concerned, that would have been a worse thing. And let's face it, in 2011, we were in a horrible recession still. We had X amount of money. We spent all the money we had. And in actual fact, we thought we would have 55 million in surplus because the economy was turning around, revenues were coming in a little higher. We took that $55 million we thought was in surplus, we put it at the top of the budget for this fiscal year, which we started already, and we said, let's spend the surplus, and we're going to have this much more revenue. So we had increased the budget to match the spending, whereas the 2011 budget had to look at what we take in for 2012 and 2013 and had to put the limits on the
right.
spending. Now we're seeing recession turn around, we're seeing more revenue, we were spending more money. So this budget spent more money because we had more money to
coming
spend.
in, sure. And while it looks good, it doesn't look great yet as far
No,
as
it doesn't
income.
look great. We're still not back where we
Right.
were before the recession. But it is better.
But we do have to watch where we go. And
We have to watch where we're going.
are there any other taxes that are being considered, or you know, because apparently you use 3 examples of $1 million increases that are needed.
Oh my God, yes. We just passed in the House enabling legislation that would let bars and restaurants that sell liquor have Keno games in those restaurants as an expansion of the lottery. Now, money from the lottery goes directly back into the public school systems. And charter schools are public school systems by federal law. So we have the public school systems that you and I grew up with, the normal ones, and then we also have the charter schools. So the Keno bill, it proposes to raise $9 million that would go directly into education. That's really money that we need. That passed out of Ways and Means last year. The House has passed it to the Senate. I'm hoping the Senate will pass it, although I hear some of them say, oh, I'd rather have a casino than this. But a casino doesn't put money into education. Charlie McIntyre, who's the director of our lottery system, running all the lottery games, used to run that agency for Massachusetts. And he put in Keno when it became legal in Massachusetts. So he has all the information he needs for the rules, the regulations, and the monitoring to make sure that it is closely monitored. And it would bring in an additional expected $9 million for education. But the reality is it would also bring in other money. Let's say we go to the bar to chit-chat about what we're going to talk about on People's View. And I have a glass of wine, you have a glass of wine. And we pretty much finish, and then we say, well, why don't we play a game of Keno? Okay, let's buy some nachos to eat. Now, we're going to pay rooms and meals tax on the nachos, whereas we would have left after the glass of wine before. So rooms and meals tax would also go up as people linger just a little longer.
Well, that seems like a more reasonable way of getting some funds.
Again, it's a user fee. If you want to play, play. If you don't want to play, don't play.
Yeah. Well, what do you see about the gambling bill that's being developed by the Senate?
There's a gambling bill in the House. There's a gambling bill in the Senate. The gambling bill in the House is 100 pages long. Okay, that's about a third of a fiction novel, and it's a lot drier than my favorite murder mystery. But I have started reading it, and it came out of the commission that we had on casino gambling, and it is very detailed about regulations because people felt like they wanted to have a good understanding of the regulations before a casino was approved. I haven't looked yet because I haven't finished the 100 pages on the House side. I haven't looked yet at what the Senate is proposing. They supported the governor last year and proposed one casino to start with. And here are a couple of interesting things. Number one, Salem's got Rockingham Park. 2, Salem has had gambling at Rockingham Park for 100 years, a century worth of gambling. At the heyday, 4,000 people worked at the park, and now there's no track there. 3, last March, Salem had a referendum on their ballot that said, do you support putting a casino in Salem? 82% of the people voted yes. So my feeling is they've got the property. They'd have to do building on the property, but they've got the space, they've got the parking. When Rockingham Park was in, they had good infrastructure. The shopping mall went right next to the racetrack, and they improved all the roads. So they have the septic, they have the roads, they have the people who said, yes, we want to have a casino in our town and we want the jobs in our town. I would be inclined to vote to support that because the people have said that's what they want. And that would bring in a lot of revenue into the state. I don't know where we'll go with it, Carl.
Okay. And is the House bill the one that has the second casino or smaller casino?
I haven't gotten through all of it, but I think the House bill also has one casino in it.
Oh, okay.
And I'm not sure it's smaller because I remember I haven't looked at the Senate at all.
I was just wondering, my experience when I was up there was that all these gambling bills came as if their lobbyists were really writing the bill. And there were a lot of things in there that weren't clear or vague or whatever. And while I don't care about gambling in a way that I don't do it that, I might go and pick up a lottery ticket, but that's about all I do. But the way it's written, I think, was a real concern to a lot of people.
The bill in the House now is very detailed. Representative Ames chaired that committee. The Attorney General, Joe Foster, sat on that committee. They had a lot of people on that gaming committee. Charlie McIntyre sat on it. They really looked in detail at what they need. And obviously, when you've written a bill that's 100 pages long, you have got a lot of detail. So they have worked out the details that you talked about that concern people before, and they had the right people at the table. I didn't sit on that, but when you've got the Attorney General and you've got Charlie McIntyre and you had, I've forgotten how many people sitting there, but you had people from all over working on this, no lobbyists, a lot of legislators, senators, House reps, and people in the field who can help. They have come up with a very detailed bill. The Senate, I don't know what they're working on, but obviously if both sides pass something, it seems like they ought to be able to get together then with the details the House has worked out. And the Senate participated in that. There were Senate members on that commission. So they are well aware of the bill, and Representative Ames is the sponsor of the bill as well. But they really dug down into those details.
Good, good. I might have to go look at it, see
Yeah,
myself,
100
because,
pages give you something to put
there
you to
go.
sleep at night.
I certainly would. Well, I want to touch on one other thing before we end the interview. Common Core in education. And from what I see, it's more or less an unfunded mandate, which we've accepted coming down from the federal government through our Board of Education and the Department of Education. And now, at least in Nashua, they feel that they're stuck with it, and they're going ahead and trying to implement it. Now, I'm not sure if you've heard about the latest feedback they got on the first trial test that they ran at one of their schools. Apparently the teachers and the principal were very, very negative about the outcome. And
Yeah, Common Core is exactly like a casino. There are strong proponents, and there's a strong opposition. People think Common Core is the next best thing since sliced bread. People think it is the devil incarnate. I'm not sure where we're going to go with this. I mean, No Child Left Behind was a failure from the time it was passed. It was passed under Bush. It is a nice advertising slogan. But today we have kids who are born into a neonatal intensive care unit who stay a long time there. We are now able to save bodies. We're not really able to grow the mind outside of the mom's body, and we can't figure out why. My high school in Hudson, Alvern, has high school students in diapers. If you can't be toilet trained, the chances that you can do work equivalent to a high school student are very small. And you hate to say children are left behind, but sometimes the mental capacity isn't there. So No Child Left Behind said you're going to make adequate yearly progress and all your special ed kids will make this progress. And the reality is that is next to impossible. If you do not have the IQ, if you have a handicap that is a mental handicap that prohibits you from grasping how to do algebra, how to write on the same level as the rest of us. And we see that Down syndrome's kids are that way. Sure. You are left behind. It's tragic, but you are left behind. Common Core, again, is teachers in my district say we already have our plates full and it's adding more, but the school day doesn't get longer. The reality is if we can teach everybody to read on grade level in first, second, and third grade, if you read really well, you can teach yourself anything later.
Right.
And research says if you're not reading on grade level by the time you're 9 years old, it is a real struggle to bring you up to grade level reading. And then writing follows behind reading. So when they start to have people really do more writing in the later grades, if you don't read well, your writing doesn't keep up. We need to emphasize reading and writing in the basics.
Well, that affects all the stuff that you're going to learn after
Yes.
that. I mean, there were two concerns that I've heard a lot about. One, the cost of the computers that are needed to do the testing as you go along. Two, the fact that reading is not emphasized as much as writing is. And reading, as you said, develops your writing and your ability to communicate.
Yes.
The incident that happened, I guess, about a year and a half ago, where Nashua and the Nashua Community College was reviewed, and they found out that like 180 or 200 of our high school graduates had to take remedial classes at the Common Community College. I don't know what's been done to correct that, but that seems to be a failure of maybe the reading ability of those people.
It's a failure of the reading ability. It's also the fact of life. We pass kids on whether they can do the work or not. You don't want a big, tall kid who's still in with 8-year-olds in a class. So
But
you pass them along.
It's even worse if he's along.
And that is worse for that child because then he or she just doesn't grasp the skills and continues to fall farther and farther behind, gets a degree, goes to college, gets tested, has to take remedial courses.
And a lot of times that doesn't work. I mean, there were some people that had 3 or 4 remedial courses to do that.
Yes,
But that's a shame.
yes.
And evaluating them too, my concern was you have a number of different levels, not only the special needs children, but ones who have English as a second language or some other, handicap, let's say, whether it's, the children that don't get enough to eat certainly aren't really as well equipped to learn.
No,
So all those things, they don't separate those. It's a one system fits all again, whether it's healthcare or education.
Yeah, it's really hard. I know in Hudson we've gone to a computerized payment system for lunches where your parents pay up ahead, so you can't tell who's on free and reduced lunch, because kids in middle school and grade and high school don't want to appear to be
Sure.
on free and reduced lunch. So, but now you can't tell. And our CAFs are open for breakfast and they're open for lunch, but they're not open on the weekends.
Right. Mhm. Well, then this happens out in Utah. Was that it just was reported about? They had a system like that, and then but the problem was they didn't have a way of telling the parents when they used up all their money on.
Oh,
the
when they
system.
threw away those lunches?
Well, yeah, and they really embarrassed the kids by saying you
Horrible.
can't have your. So anyway, all those things, it's getting into a bureaucratic mess as far as I'm concerned. I don't know how
It
you
is.
feel
When I was
about
on the
that.
school board, we worked out a way where a kid's parent who hasn't paid the lunch, kid got a sandwich and an apple and some milk for lunch, and so still got lunch.
Well, yeah, but some of these requirements now for lunch, the kids don't eat it; they throw it away. What good is that?
I don't know.
Now, there should be some kind of feedback mechanism. Hey, guys, you got it wrong. Our kids don't like sweet potato fries or something or other. I like them.
Yep, me too.
Well, any case, I really enjoyed talking to you today, and thank you for this interview.
I enjoyed being here.
Good, and we'll have to do it again.
We will.
Okay, we'll wait until the Senate gives you something to talk about.
Something new to talk about when we get the casino bills.
Right, right. Okay, well, thank you very much again.
Thank you, Carl.
Okay, and thank you for listening in.